When you turn 65, you suddenly have to figure out Medicare, and you've got 4 parts, 10 supplements, and dozens of plan options to choose from. And if you make a mistake or miss a deadline, you'll pay penalties for life or get stuck with a plan that doesn't really meet your needs. Hey y'all, I'm Callie, and I'm a licensed insurance broker and certified Medicare expert. And I help people across the country understand Medicare in a simple, easy to understand way. And with so many options, Medicare Parts A, B, C, and D, you might feel like you're in a little over your head, especially if you're about to be 65, because this works so much different than how your health insurance worked before. But don't worry, by the time you're done watching this, you'll have a clear understanding of what Medicare is, which parts cover what, and how to avoid penalties and surprises later on down the road. All right, so Medicare is made up of 4 parts, A, B, C, and D, and each part covers something different. And while some are essential, some might not even be necessary depending on your situation. Now, traditional Medicare is Parts A and B, and Part A is your hospital insurance, and it covers your inpatient hospital stays, skilled nursing facility care after a hospital stay, hospice care, and some home health care. And most people, about 99% of y'all, don't pay a premium for Part A if you or a spouse have worked and paid Medicare taxes for at least 10 years. For the other 1%, the premium for Part A can cost you anywhere from $285 and $518 per month in 2025. So basically, if you work long enough, Part A is essentially free. Now, Medicare Part B is your medical insurance, and it covers things like doctor's visits, outpatient surgeries, lab tests, and some preventative stuff like flu shots and screenings. And for most people, the standard Part B monthly premium for 2025 is $185 per month, which is up from the $174.70 per month amount it was in 2024. If you're already collecting Social Security benefits, your monthly premium is automatically deducted from your benefits each month. But if you're not yet receiving Social Security, you'll pay that premium directly to Medicare. And you can do that in a couple of different ways. You can either pay Medicare directly for those premiums when they send out a bill, or set up Medicare Easy Pay, which will automatically deduct the premium amount from your checking account. That $185 Part B premium is actually based on your modified adjusted gross income from 2 years ago. So for 2025, they're going to look at your income from 2023. And if you made more than $106,000 as a single filer or $212,000 as a joint filer, your premium will be higher. And this is what's called your income-related monthly adjustment amount. And I'll put a link in the description below to the IRMAA chart that you see on the screen, because this will help you figure out how much you can expect to pay for your premiums if you are a higher income earner for 2023. So if you're already budgeting for healthcare, please be prepared for this cost. Now, you can actually appeal this IRMAA penalty if you used to make a decent income, but you've had a qualifying life event like retiring, cutting back on work hours, getting divorced, or even losing a spouse. And I've put the appeal form in the description below, so take a look if this sounds like your situation. Now let's take a look at some of the costs under traditional Medicare, your Parts A and B. Because while Medicare covers a lot, it definitely doesn't pay for everything. So this means you'll have out-of-pocket costs like deductibles, co-pays, and co-insurance. And if you're new to Medicare, something to note here is that your premiums, deductibles, and co-pays change every year. So for example, in 2025, the Part A deductible is $1,676 per 60-day benefit period. And this isn't a yearly deductible. This deductible resets. So the Part A deductible covers your first 60 days of inpatient hospital care, and after that, you'll have to pay $419 per day for days 61 through 90. And for any stays beyond 90 days, that cost per day jumps up to $838 per day, and that is using your lifetime reserve days. As a Medicare beneficiary, you have access to a total of 60 lifetime reserve days, and these are reserved for if or when you stay in the hospital for more than 90 days during a benefit period. And these days can only be used once in a person's lifetime. Now, Medicare Part B, which is your medical coverage, includes your doctor's visits, outpatient care, procedures, diagnostic tests, durable medical equipment, and even cancer treatments. The Part B deductible in 2025 will be $257 per year, which is up from $248 it was in 2024. And once you meet the deductible, Medicare pays for 80% of your medical costs, but you're responsible for their other 20%. And that can really add up, which is why so many people on Medicare choose additional coverage or alternative options to cap out their out-of-pocket costs. So when it comes to coverage, you have 2 options to choose from. And the first is to stick with traditional Medicare, Parts A and B, and add on a standalone Part D prescription drug plan. Part D covers your medications, and it's offered through private insurance companies. And premiums average around $48 per month in 2025, and the cost can vary, and you'll want to check if the plan covers the specific medications you take. And if you decline to take Part D, you could face a penalty if you enroll later. So I always recommend signing up when you're first eligible unless you have credible drug coverage through an employer or your spouse's employer, because that Part D penalty does stick with you for life, and you're charged 1% of the standard Part D premium for every month you don't have credible coverage. And there are lots of big changes coming to Medicare in 2025, and one of those is the increase in the standard deductible, which is $590. However, not all medications require you to meet the deductible, especially a lot of generic drugs. And the biggest Part D change is the introduction of the $2,000 out-of-pocket spending cap for covered drugs. Only costs for covered medications will count towards that $2,000 cap, so if a medication isn't on the plan's formulary, it doesn't count. And the best way to find the right Part D plan is to do a personalized search based on your medications, your zip code, and your preferred pharmacies. So I'll link some resources in the description below to help you out with this. Now, let's go back to that second option, and that's Part C, also known as Medicare Advantage. These are Medicare plans through private insurance companies, and they bundle Parts A, Part B, and usually Part D into one single plan. Many plans have extra benefits like vision, dental, and hearing coverage, and some also even include an over-the-counter benefit card and gym memberships. And since Advantage plans are managed by private insurance companies, they do have networks and restrictions, and they essentially replace your original Medicare plan. But they operate pretty similarly to how your health insurance worked before Medicare, which is why it's also a popular option for many. The cool thing about most Medicare Advantage plans is that they have $0 premiums, but you'll still need to pay your Part B premium, and you should always pay attention to the additional costs like copays, coinsurance, and out-of-pocket limits, which can vary depending on the plan that you choose. Now, you might be wondering which of these parts are mandatory and which ones are optional. So think of it like this. Medicare Parts A and B are like the foundation to your Medicare. You'll need both of those to have the most basic coverage. Part C, Medicare Advantage, is optional, but if you want to enroll in an Advantage plan, you'll have to be enrolled in Parts A and B. And Part D is technically optional, but remember, if you don't have credible drug coverage, then you will be charged a Part D late enrollment penalty, and that sticks with you for life. And if you don't take Part B when you're first eligible, then you will face another lifetime late enrollment penalty as well. You'll actually pay an extra 10% for each year you go without Part B coverage when you were supposed to have it. So to put it simply, think of Medicare Parts A, B, and D as mandatory, whether you need prescription coverage right now or not. If you stick with traditional Medicare Parts A and B and a standalone Part D plan, most people add on a Medicare Supplement plan, also called medigap. And medigap plans are optional, but these plans help cover your 20% of deductibles, copays, and coinsurance that you owe after Medicare pays that 80%. The nice thing about medigap plans is that they're standardized, guaranteed renewable, and don't have networks, so you can see any Medicare doctor anywhere in the country. But, and this is a huge but, they're expensive. The average medigap plan costs about $164 per month in 2024. And unless you sign up for a medigap plan when you're first eligible for Medicare age 65, you'll have to go through medical underwriting and answer a bunch of health questions, and you could potentially be denied coverage or get charged a higher premium. It's entirely up to the private insurance company that you decide to go with for that medigap plan. If you decide to get a medigap plan, Plan G is one of the most popular options, but a lot of people are asking me lately if it's still going to be around with the new administration's picks. And as far as I can tell, so far, Plan G isn't going anywhere. It's a solid plan and provides the most comprehensive coverage. Now, I get a lot of questions from people still working at age 71, and they're really worried that they're going to be charged a late enrollment penalty if they don't sign up for Medicare right away at age 65. But there's one more thing to keep in mind, and that's if you're still covered by a spouse's health insurance plan or your own employer's health insurance plan when you turn 65, you don't have to enroll in Medicare right away. You'll have a special enrollment period when you're no longer covered by your spouse's insurance or your own, and that's when you'll need to sign up for Medicare. So here's the deal. As soon as you stop working or lose your spouse's insurance, you'll need to enroll in Medicare within 8 months to avoid penalties. And what about military retirees? Well, if you've got Tricare for life, that's fantastic because Tricare works with Medicare and they actually coordinate benefits. But just something to keep in mind is you still need to sign up for Part A and Part B, and Medicare becomes your primary payer, and Tricare steps in and pays second. Tricare covers Medicare's coinsurance and deductibles for services covered by both programs. I also hear a lot of concerns about how the financial side of things works. And if you're spending $300 to $500 a month on traditional Medicare and a supplemental insurance plan, that could be a big chunk of your income, especially if you're living on Social Security or SSDI. And just flat out unreasonable. And this is why Medicare Advantage is so popular with so many people because 75% of enrollees are in a Medicare Advantage plan with prescription drug coverage and with a $0 premium. And if you're wondering if you can switch back from Medicare Advantage back to original Medicare, the answer is yes, but you'll need to do it during the annual enrollment period, or AEP for short, and that runs from October 15th to December 7th each year. And be aware that you might have to go through medical underwriting if you want to buy a medigap policy. Both options have their pros and cons, and what's best for you depends on your healthcare needs and budget. If you found this helpful, please like this video and subscribe to our channel for more expert Medicare tips. And I know this was a lot of info to take in, but don't worry, I'm here to help. If you need a personalized guide through your Medicare options, click the link in the description below to schedule a completely free consultation with me. I'll make sure you're on the right track and help you choose the best plan for your health and budget, and make sure that you never pay more than you absolutely have to. And after that, be sure to check out this video right over here where we talk about the 5 big changes that are coming to Medicare in 2025. As always, thanks so much for watching, and I'll see y'all in the next video.